Stages of hypovolemic shock. Stages of hypovolemic shock. So hypovolemic shock, just like I said, hypovolemic shock is a type of shock that is as a result of what? There is decrease in the fluid levels of the body. Or you could just say blood volume. Because one thing is that the blood contains the fluid, right? So there's decrease in blood volume. So normally your blood volume is supposed to fill up this place. But now it is decreased. So now what? The speed at which blood is moving through the body and all that is reduced and all that. Okay, so let's talk about the stages. We said that now, if the inciting pathology is left unabated, hypovolemic shock progresses in severity of three stages. We have the compensated, decompensated, and what? Irreversible. Now, for the compensated, we said that it occurs when the hemorrhage is less than what? 20% of the total blood volume. So if you have lost less than 20% of the total blood volume, then you have a type of shock that you can compensate for. Possibly, you can heal from this type of shock, okay? Now, while the perfusion is suboptimal, physiologic mechanisms act to adjust. So your body is kind of like what? Trying to adjust. So the physiologic mechanisms act to adjust systemic vascular resistance, and this can sustain what? Systemic pressure. Brain and heart perfusions remain normal because these are vital organs. So the body will act like what? Reduce blood supply to some other less important organs and supply the brain and heart. Okay. Then excessive and inefficient use of oxygen by the heart makes it vulnerable to ischemia. All right. Then going to the decompensated shock now. We said that patients become hypotensive because the intravascular volume deficit exceed the capacity of the vasoconstrict mechanism to maintain. So now that's like the shock has been there. So it is now going to a level where your body cannot actually compensate for it. Okay. Patients are at the risk of death owing to deficient delivery of oxygen to vital organs and also an impaired mitochondrial aerobic energy production. Right? So cellular perfusions must be restored before irreversible damage to the cell biochemical pathways will occur. Okay. Then talking about the irreversible one now. The irreversible one is mostly like I've gotten to the end stage, so nothing can actually bring you back. Okay. So progressive insult leads to multi-organ dysfunction syndrome. Okay, this can set in, including a damage to things like the lungs, where you're having what? Respiratory distress. For the heart, you might be having what? A low blood pressure. For the kidneys, you're having acute kidney infections or damages, right? Or diseases, right? Then for the CNS, you'll be having coma. For the liver, there'll be jaundice. For the GIT will stop moving. That's why we say it as an ileus, right? Then for the blood will just be clotting anyhow. That's a coagulopathy. So now this shock is irreversible, right? So this will progress to what? Multi-organ failure, which is a direct precursor to death. All right. So beautiful. Those were the stages of what? Hypovolemic shock. Compensated, decompensated, and irreversible.